Hello, I'm Professor Emily Mercuri, and this is Chapter 7, Responsibilities and Principles of Drug Administration from Essentials of Pharmacology for Health Professions, 9th edition. Chapter Objectives. Upon completion of this chapter, the learner should be able to 1. List at least 4 responsibilities of the healthcare provider in safe administration of medications. 2. List the 7 rights of medication administration. 3. Explain moral, ethical, and legal responsibilities regarding medication errors. 4. Describe 2 instances of medication administration that require documentation. And 5. Explain the rights of the healthcare professional to question or refuse to administer medications. Responsible drug administration requires knowledge, judgment, and skill. There are 4 critical responsibilities a healthcare professional should adhere to when administering any medication. So the first principle here is have adequate and up-to-date information about all medications to be administered, which includes purpose, potential side effects, contraindications, cautions, and possible interactions. So in order to do this step properly, you need to know why you're giving what you're giving. If you are, let's say, giving Zofran, which is usually an antiemetic used for nausea or somebody who's actively vomiting, you need to know if they're not nauseous and they're not vomiting, why are we giving it? So I want you to stop and think of those things as you're giving a medication. I know what this is for, and this patient isn't having any of those symptoms, so why are we giving it? An example would be oftentimes we will give Zofran at the same time we give morphine or Dilaudid, a narcotic medication, because those medications tend to make people feel nauseous, so we're using that as a preventative for nausea. But if I didn't know that that was used in that way and I saw it as an order, I would stop and I would make sure I clarified why I'm giving this. So we need to make sure we understand the purpose. What are the side effects? We should be telling our patients, this may make you, for example, morphine. This may make you feel drowsy. If you take this medication, you can't drive for X amount of hours after this. So making sure that we're aware of those things. And then contraindications, cautions, we want to know if they are expressing some kind of contraindication, if they have a condition that this shouldn't be used for, if they are over a certain age and that medication's not recommended for someone over that age, that kind of thing. And then possible interactions includes knowing what their normal medications are. So some medications, if used together, can cause devastating side effects and could even cause death in some cases. And so if you are giving a medication to a patient and you don't know what their normal medications are, you need to be cautious. For example, if the patient is on a pill every day that acts as an anticoagulant, or what we would refer to as a blood thinner, and you're giving them an injection of another blood thinner because you didn't know, that can have a combined effect of causing bleeding all throughout the body. So we need to make sure we have an idea of the patient's history as well. Demonstrate wisdom and judgment to accurately assess the patient's need for medication and be able to evaluate the response to medications and plan appropriate interventions as indicated. I'm going to go back to the example of a narcotic like morphine. Maybe a patient has 10 out of 10 pain. They have a fractured leg, let's say, and it is indicated for this amount of pain. It could help them with their pain, but I know that they might get drowsy afterwards and they might breathe kind of shallowly afterwards. That is a side effect of a narcotic medication. I'm going to make sure I have the ability to give them a little bit of oxygen support if that happens. I'm going to make sure they are on a monitor so that I can see if those side effects happen. So you want to make sure that you're prepared and that you are wise about what you're giving and what the effects of that medication might be. You must possess skill in delivery of the medication accurately and in the best interest of the patient, and also demonstrate adequate documentation. We have this phrase in healthcare, if it's not documented, it wasn't done. So you need to know how your facility documents medications. Sometimes it's on paper if you are in more of like a long-term care type of facility. typically in a hospital setting, you will be using an electronic method where you're scanning the patient and scanning the medication. But scanning alone is not enough. You need to also be looking at the patient's identification at their wristband that they have on. You need to be reading the medication because we don't want to, forego our checks just because we have a scanner. And then skill and delivery. Some medications are going to be given over a longer period of time, especially if you're talking about an IV medication. So it will say in the reference guide, this medication is to be pushed over 2 minutes. You're going to push that very slowly into the IV, and you're going to flush it at that same rate versus just kind of slamming it into the IV. That could cause harm. And so you need to be skillful in how you deliver it, and you need to understand how you're administering it. And then provide patient education to the patient and family about why, how, and when medications are to be administered and their potential side effects and precautions with administration by the layperson. Layperson means just your standard person, not in healthcare, doesn't have a strong education about or a strong background in medicine or in pharmacology. And so patient education needs to include the purpose of the medication. Why are you taking it? How does it work in the body in a way that makes sense to somebody who doesn't have that extensive background? What time of day and how often, and then what to be looking out for, those potential side effects. Your project at the end of the semester is going to be to create a patient education pamphlet. And I think that will really flesh this concept out so you can see all of what needs to be shared in patient education for a specific medication. Other responsibilities of a healthcare professional for safe administration of medication include familiarity with every medication before administration, knowledge of the typical and most frequently used drugs to treat the body systems. So with this one, there are usually something that we call first-line drugs. So as I mentioned in the prior slide, something like Zofran, that's given for nausea or for vomiting. And it's a first-line drug, meaning it's usually the first thing we will use for most patients unless there's a contraindication. It's the first thing that we'll choose for nausea or vomiting. And then if that doesn't work, we may move on to another medication such as Compazine, but we're going to usually go with that first line at the beginning. And so you want to be aware of the typical and most frequently used drugs for specific body systems and specific ailments. But there is also, when you're working, you might be in like a specialty unit. And so you will know in that case what are the typical drugs used for your specific specialty. So for example, labor and delivery. In the ER, we don't usually deliver babies unless they are actively already being born, in which case we're not really worried about medications. We're just trying to make sure the baby's coming out safely. So I have a vague understanding of labor and delivery medications, but I don't have this more in-depth knowledge like I do with the drugs that we use for something like cardiac arrest or a hypertensive crisis. I'm working in a very different environment. Same thing with my sister. She works in oncology. So she knows a lot about chemotherapy. I don't know a lot about chemotherapy because it's not something that we give in an emergency setting pretty much ever. So you'll find that as you get into your specialty, you'll also start to have this knowledge of what's used in your subspecialty as well, and that's okay. If you ever have to give something that's not commonly used, you just look up that reference guide and become familiar. You also need to have complete planning for patient care, including that prior assessment, intervention, and evaluations of the results of drug therapy. So you should be assessing the patient before you give medication. Maybe the doctor wrote the patient needs to have a medication for high blood pressure, and you go take their vital signs and their blood pressure is actually low right now. Well, I'm going to hold that medication because it's going to drop the blood pressure even further, right? So you would know that if you were doing a prior assessment. Assessment of the patient and their current drug regimen, including prescription and over-the-counter medications. Again, supplements, prescriptions, any type of medication the patient's taking could interact with what you're giving them now. And then assessment of the patient's overall health status, including the aforementioned vital signs, posture, skin temperature and color, and facial expressions both before and after drug administration. Keep in mind that Not all patients are verbal, and so not all patients can communicate to you by saying, oh, yes, my pain is relieved, right? So that's where we really need to pay attention to those facial expressions, to those nonverbal cues. Do they look more comfortable? Are they less restless? Are they breathing more calmly, right? So we have other cues that we need to take into account besides just the patient's self-report. The goal of safe administration is to maximize the effectiveness of a drug with the least amount of discomfort to the patient. Patient education is an essential part of safe drug administration, and they must understand the importance of taking medications in the proper dose, time, and way. Providing both verbal and written instructions and demonstrating proper administration techniques will provide the patient the information and skills needed to perform self-administration. I will also say on this note that we prefer what's called the teach back method. And so I teach you how to administer a medication, and then I have you repeat that back to me or actually show me. This is especially true with a medication that's an injectable medication, right? Patients have probably never given themselves an injection before, but many medications like insulin, as I said before, the GLPs like Ozempic, even some blood thinners, they're given in a shot, usually in the abdomen. I want to make sure the patient knows how to do that safely. And the best way to do that is to teach them and have them teach it back to me, explain it back to me as if they're teaching me, and then actually do it themselves while I'm observing so I can make sure that that's being done properly. Ethical drug administration. Administration of medicine carries moral, ethical, and legal responsibilities. When in doubt, always consult with those in authority. In the healthcare setting, in the hospital setting, you would be consulting with the physician, with the pharmacist on staff, with a more senior nurse. If you are working in the pharmacy setting, you would consult with a more senior pharmacist. You would look at your policy and procedure manuals. There's always someone to consult if you need to have more information about this medication or you have doubts about the medication. Refer to the policy and procedure handbook when needed. Provide patient education when needed, even if the patient says they don't need patient education. We want to really make sure that we are ethically giving medication, that the patient knows what to do, because I can't tell you how many times I've seen a patient come in because they took their medication entirely wrong and now they're in bad shape. I once had a patient who they thought may have had a stroke because she was so confused. And it turns out, as I was getting her in her gown, she had a bunch of Benadryl packages in her pocket. And she thought every time she felt itchy or she sneezed or anything like that, she needed to take one. So she had taken one every hour or two, and she was extremely drowsy. She was altered. And so that's even an over-the-counter medication, right? We don't necessarily have the chance to provide education on those things because they're not prescribed. But you can see how quickly a medication can actually cause harm if the patient doesn't know what they are using it for or how to use it properly. Always document in the patient's chart for all medications administered. Let's say I gave a medication that for pain, again, I know I'm coming back to this a lot, but it's an easy example. So morphine, that could make a patient really drowsy. And I was really busy and flustered and I didn't scan it. I didn't scan the patient. I didn't save it in the chart. And the next nurse, the patient, they see this medication on the chart. It's not documented, so I should give more. They end up pulling more out of the machine, which is hard to do because the machine will tell you someone already pulled it up. It's usually, we call it a Pyxis, depends on the brand, but it's like a dispensing machine, right? And it should tell you, oh, someone already pulled this out. But let's say somehow they overrode that or they used a different Pyxis, right? And they go to give the medication and they give 2 doses of it. Well, now that patient got double the dose they were supposed to have because you didn't document it. So it's very important that you're documenting in the chart every time you administer a medication. And then always remember to record controlled substances in the narcotics record in addition to the patient's medical chart. This more applies for long-term care or places where they aren't using as robust of electronic records. They have an actual controlled substance log to help make sure that the substances are being given and that no one is taking the medications or diverting, what we call diverting, where they are stealing the medications. So that narcotics record, the controlled substance log, is usually used more in long-term care. But I will say in the hospital that once a week we do a full count of all of our narcotics. And if there is any kind of discrepancy, then that gets followed up on immediately. Medication errors. Medication errors can occur in any healthcare setting. Acute care settings report more errors, where the risk is greatest. Acute care setting refers to a hospital setting typically, so a setting where the problem is acute, meaning it's sudden, it's a new problem, people are coming in for treatment of that. Ambulatory care sites, home health care, outpatient facilities like doctor's offices, and long-term care facilities like a skilled nursing facility also have challenges unique to their practice. It's important to know that when the number of medications for an individual increases, the risk of interaction and adverse side effects and the risk of error also increase. There's something called polypharmacy, poly meaning many, and polypharmacy refers to when a person has a lot of different medications prescribed, and as the number of medication goes up, the risks that they may interact, that they may either cancel each other out or potentiate, make each other's effects stronger. It's a greater chance when you have someone who has this polypharmacy. They have many medications. And as you can imagine, it typically happens in our elderly. The older you get, the more kind of chronic problems can kind of build on each other. And we need to make sure that there is a medication reconciliation being done where we are aware of what they're actually on currently and that somebody is keeping track of that. So let's say they come in from Kaiser is their main provider and they go to the Kaiser outpatient pharmacy. They have a primary care physician through Kaiser, but they come to a community hospital for their care. And the community hospital doesn't access the Kaiser records. They prescribe something new without doing that medication reconciliation. That could cause a problem for the patient. So medication errors as listed here, giving the medication to the wrong patient at the wrong time, the wrong drug or drug form. So maybe it was supposed to be extended release, but you are giving an immediate release, or it's just the wrong drug altogether. The wrong dosage, the wrong route, giving something via injection that was meant to be oral, that kind of thing. The wrong technique, and the wrong documentation. So I want you to think of these 7 things as things that can be considered medication errors. And we will also call those the rights. So on the flip side of the things being wrong, we would say in order to give a medication correctly, it needs to be the right patient, the right drug, the right route. So you can flip that around as well. Medication reconciliation, as I mentioned on the last slide, is a method used to compare the medications a patient is currently taking to the medications ordered by the physician. Medication reconciliation is done to prevent medication errors caused by omissions, duplications, errors in doses, or medication interactions, and it should be done every time the care plan changes. The 5 steps of reconciliation: 1. Develop a list of current medications. 2. Develop a list of medications to be prescribed. 3. Compare the medications on the 2 lists. 4. Make clinical decisions based on the comparison. And 5. Communicate the new list to appropriate caregivers and to the patient. So an example of this would be a patient has high blood pressure and the doctor wants to prescribe metoprolol. But they go into the current list and see that the patient's already on lisinopril, which is a different high blood pressure medication. Maybe the patient does need a second different class of high blood pressure medication. Maybe they just need their lisinopril increased, or maybe the doctor wants to cancel the lisinopril and start the metoprolol. If you look at both lists together, you're going to be able to have a better idea of how to do that and how to do it safely. And moving forward, which medications need to be discontinued or which dosages need to be changed, etc. 7 rights of medication administration. So as I shared before, those wrongs, these are the opposite of the wrongs. You will typically hear this referred to as 7 rights of medication administration. This is more common language than referring to all of the wrong things that you can do. So I want you to focus more on this slide here. Right medication. So carefully compare the name of the drug prescribed with the label on the package, bottle, or unit. Never give a medication when the name is obscured in any way. So if you cannot read the label or it's covered by a stick or something like that, you should not give that medication. You need to get a new medication for that patient. Right amount. The drug dosage ordered must be carefully compared with the dose listed on the label of the package, bottle, or unit dose package. Right time. Drugs must be given at a prescribed schedule. The order from the physician will specify the number of times per day the medication is to be administered. Right route. The route's important because it affects the degree of absorption, the speed of drug action, and the side effects. Right patient. The patient who is to receive the medication must be identified by their name and date of birth to reduce the chance of error. So we always say every time you administer a medication, you need to have at least 2 identifiers. And usually we will use the name and date of birth, or sometimes the name and the medical record number, or sometimes even all 3. What you don't want to do is use a form of identification that can change, such as the patient is in room 2. Don't use the room number as an identifier because the room number could change. We can move that patient, right? So typically what we'll say is name and date of birth, or name and medical record number, or all 3. Right documentation. Every medication given must be recorded in the record along with the dose, time, route, and location of the injection or how the medication was taken. And then right technique. Each route and medication must have or may have specific rules that apply regarding the technique for administering. The individual administering the medication must be knowledgeable on various techniques. For example, this medication is to be given intramuscularly in a large muscle. And so as an individual knowledgeable about muscle groups, you know that it would be on the vastus lateralis along the side of the thigh, or on the backside. There are certain identifying marks in which you inject. And so knowing the technique, knowing how to give the medication is important as well. Knowledge check. The ability to accurately assess a patient's need for medication and evaluate the response to medications, planning appropriate interventions, is known as blank within the 4 responsibilities of safe medication administration. A. Wisdom. B. Providing patient education. C. Adequate delivery. D. Skill in delivery. Remember, the question is asking for the ability to accurately assess a patient's need. And the answer is A. Wisdom. Knowledge check. Which of the following rights of medication administration affects the degree of absorption, speed of drug action, and side effects? A. Right time. B. Right route. C. Right technique. D. Right amount. And the answer is B. Right route. Remember that certain forms of administration, such as intravenous, are going to be immediate, whereas other forms are going to take longer. Knowledge check. All are examples of ethical, moral, and legal responsibilities regarding medication errors, except what? A. Provide patient education when needed. B. Always document in the patient's chart for all medications administered. C. When in doubt, use your best judgment. D. Refer to policy and procedure handbook when needed. And the answer is C. When in doubt, use your best judgment, because the answer should be when in doubt, consult an expert. Medication administration and documentation. Every medication given must be recorded in the patient's chart. It's imperative to provide detailed information, including dose, time, route, and location of injection. In addition, it is important for healthcare professionals to document any adverse reactions to medications. Accuracy is crucial, and the individual administering the medication must be the one to complete the documentation. Example when it says location of injection is, let's say I have 2 medications and one is going in the right thigh, one is going in the left thigh of the patient. They develop a welt around that area. They're having a local reaction to that area. If I document properly, I'll know which medication caused that reaction. And so then I can mark that in their chart. Hey, this medication, they may have a mild allergy to it. So it's important that we're always making sure we document where things are given on the body as well. Narcotics also need to be documented accordingly. This should be documented on the Special Controlled Substance Record. If narcotics are needed to be destroyed due to partial dosage, cancellation, or error, two healthcare professionals are required to sign as witnesses to the disposal of the drug. In the hospital system, this is done in a Pyxis, in a medication dispensing machine, at least in most hospitals in this area. There are rural hospitals that are probably an exception to that. But what this looks like is if I go into a room and the patient says, you know what, my pain is not that bad. I decided I don't want the morphine, but I already took the morphine out of the system. I have to go back and return it. And another nurse needs to be there to witness and enter their employee ID and credentials to make sure that I didn't just take that medication and put it in my pocket and take it home. Knowledge check. Which of the following would need to be recorded in the controlled substance record? A. Heart medication. B. Blood pressure medication. C. Pain medication. D. Diabetic medication. The answer is C. Pain medication. I don't love this question, however, because it's only narcotic pain medication. So not all pain medications are narcotic. Think of something like ibuprofen, right? That doesn't need to be witnessed, but something like morphine, fentanyl, Dilaudid, oxycodone, some of our narcotic medications, that will need to be recorded in a controlled substance record. Medication administration refusal rights for healthcare professionals. Safe and effective administration of medication involves current drug information, technical and evaluation skills, moral, ethical, and legal responsibilities. So using those 7 rights of medication administration as our guidelines, we have the right to question any medication order that may be confusing, out of the ordinary, illegible, meaning if it's handwritten and you can't actually read it because it's messy writing, or inappropriate. In addition, they have the right to refuse to administer based on those findings, and if they feel it is not in the best interest of the patient due to any discrepancy. The safety of the patient is the first priority. I have an example here from my own practice. I had a patient who had a bleed in their brain. So they were having bleeding in their brain, which is a very critical, time-sensitive matter, right? So the doctor ordered a medication that is a reversal agent for the blood thinner that the patient was taking. I know that this particular reversal agent, when given, runs over 15 minutes. It's given very quickly to quickly allow the blood to hopefully clot better so that it slows the bleeding. The way that the physician ordered it and the way that the pharmacist approved it, so it had gotten already through the physician and the pharmacist, told me to run the medication over 2.5 hours. Because of my experience, I knew that that's not correct. I've never seen that medication given over that length of time. And I wasn't even able to pull it out and do it the way I knew was right because it wouldn't let me program it that way and document it that way. So I quickly got a hold of the pharmacist and the physician. I got it fixed, but I was able to what we call stop the line and say, no, this order feels wrong. It's not something I've ever seen given this way before, and I was able to get the problem fixed. So we are kind of that last line of defense if you go into the nursing profession, or that last line of defense before a patient gets something that could be harmful to them or is given something in the wrong way. So you need to make sure that you are using that right if you feel that this is not a correct order or that it's not going to be safe for the patient. Knowledge check. Which would be a reason for a healthcare professional to refuse a medication administration order? A. Legible order. B. Consistent dose information. C. Unsure who the physician is. Or D. Confusing order. The answer is D. Confusing order, but also if you're unsure of the physician and you want to verify, you can always go through the database and make sure that that is a currently practicing physician. MedWatch reporting. MedWatch is an FDA safety information and adverse event reporting program started in 1993. MedWatch provides a platform for healthcare professionals to voluntarily report adverse reaction that may occur from the use of a particular medication. When reporting, the information to include is the patient demographics, information about the medication including name, dose, how it was administered, and recording any adverse reaction. This is important because, let's say, for example, there is a medication meant to help control pain, and you notice that when you give it in patients over the age of 65, they're also becoming confused. So if you are seeing these adverse reactions, we want to report them to MedWatch so that they can add that as a warning label. MedWatch assists the FDA to monitor the safety of products. If needed, sometimes immediate action occurs to protect the public from medications that do not demonstrate positive benefits. So they may be pulled off the market, and we've seen that before with medications in the past. Fen-Phen is one that comes to mind. I think it was like the early 90s. It was a weight loss medication that was causing all of these cardiac side effects, and it got pulled off of the market, right? And it became illegal to prescribe that drug. In response to the reports, the FDA has issued warnings, revised labels, required manufacturers to do more post-marketing studies, and ordered several products to be withdrawn from the market, as I shared. You'll also see these revised labels that may have like a black box warning. Medication could result in ruptured tendons or could result in death. Like major side effects have to be listed, and that in part has to do with this MedWatch reporting from the data that they've gathered. Self-assessment. 1, what are the 7 rights to medication administration? I want you to be very familiar with those. 2, what are the 4 responsibilities of a healthcare provider in safe medication administration? 3, which 2 medication administration instances require documentation? I'm not actually sure what they mean by number 3, but I do want you to be aware of which types of medications require additional documentation, as in narcotics, and then which 2 identifiers you need to give a patient a medication. I think they worded this very strangely, but I think both of those things are important for you to self-assess. Just remember at the end of these chapters, when you see these self-assessments, this is a great way to guide your studying. Thanks for listening. This has been Chapter 7 of Essentials of Pharmacology for Health Professions, 9th edition.